Hi, I'm Dr. V. I'm with the Alaska Raptor Center. I'm the veterinarian here.
We've been hearing a lot about highly pathogenic avian influenza. What is that?
Okay, so HPAI is a virus that is sweeping the country right now. It is called highly pathogenic because the definition of that is that it kills chickens. It's highly pathogenic to chickens. This particular strain of avian influenza also is deadly to raptors, and that is what has us very concerned here at the Alaska Raptor Center.
What are the symptoms that we could watch out for?
The symptoms of avian influenza in eagles surprisingly seem to be primarily neurologic. You think avian influenza, you think respiratory, and yes, they can have respiratory symptoms. What I have seen on videos is nervous signs like shaking, stumbling around. What I have seen personally in Sitka is basically a fading eagle. It is becoming depressed, it's becoming weak, and within 48 hours it has died.
What steps is the Alaska Raptor Center taking to protect our residents?
We have taken pretty extreme measures here at the Raptor Center to protect our residents. They are very, very important to us. Avian influenza is easily transmissible. It's a little different than COVID. COVID goes through the air primarily, whereas avian influenza is tracked in on fomites. Now, what is a fomite? A fomite is an inanimate object that can carry a virus. So shoes are the biggest fomite that we worry about. So we could go into the park, get it on our shoes, track it into our bird cages. So we are actually changing shoes when we get here. The most important thing we've done to protect our birds is we have stopped rehabilitating all wild birds on site. And that's because if we brought in a bird with avian influenza, all the fomites, the kennel, our shoes, our gloves, our jackets, we could far too easily give it to one of our resident birds. So at this point, all sick birds are coming to my veterinary clinic, which is off-site.
Is there anything the general public needs to do to help with this problem?
This is tough because there isn't a lot that the general public can do. If you find a dead bird, you can contact your state vet. They may want to test it. It's best that you do not touch it because it can be transmitted to humans. Fortunately, very few humans have acquired it, and it seems to be pretty mild, but we still don't want you picking up the bird. But calling your state vet, probably worth the effort because we need to know, is it still spreading across the United States?
Should people still have up their bird feeders?
This is a tough question. Do you keep your bird feeders up? You can go online and you can look up your state and see if avian influenza is there. The West Coast still has a couple of states where it is not there. So I would say you could still keep your feeders up. If avian influenza is in your area, we do recommend taking down your feeders. Now, it is not as harmful for songbirds as it is for raptors, but we don't want birds congregating and potentially spreading it, even if it isn't really harming the songbirds. So once we had a positive case in Sitka, I did take down my bird feeders.
Thank you so much for sharing with us, Dr. Vosburg.
You're welcome.